Hi everyone, it's Dr. Jhawar with Revive MD. I want to end Heart Health Month by talking a little bit more about blood pressure, specifically the difference between the top number and the bottom number when you look at your blood pressure. Many times patients think the top number is the more important number and the bottom number is not as significant. And that's actually not true. Both the top number or the systolic blood pressure and the bottom number or the diastolic blood pressure are equally important when we're talking about risk for heart disease and strokes. So let me explain. So that top number or the systolic blood pressure actually measures when the heart is contracting. The bottom number or the diastolic blood pressure is telling you more about the heart muscle when it's relaxing or in between the heartbeats. So they both are actually quite important. And even when we see patients with higher diastolic blood pressure readings, we do actually get concerned because that is a big risk factor for heart disease and strokes in the future, even kidney disease as well. So what are some of the things that can, sort of cause higher diastolic blood pressures? It's the same things that cause high systolic blood pressures. So the same risk factors like obesity, diabetes, smoking, excessive alcohol use, certain medications, family history as well. And many studies have shown that diastolic blood pressure is oftentimes seen elevated in younger generations. So it's really important to start getting screened for your blood pressure at an earlier age, in fact. So I just think it's really important to know that it's not just about that systolic blood pressure, but the diastolic blood pressure is equally important. And when we say elevated diastolic blood pressure, really that starts at, probably around the mid 80s range actually and higher. So it's not just when you're getting to like 95 or 100, that's already pretty high. But I think that's important to, understand that both of those numbers are very important when we're talking about risk for heart disease and strokes in the future. All right, I hope that helps answer some questions, and I'll be back with more videos.